Somatic mutation theory is that cancer is due to somatic mutations in the nuclear DNA. So somatic mutations as opposed to germline mutations. So germline mutations are inherited from one generation to the next, whereas somatic mutations are acquired. So carcinogen will cause somatic mutation. Intermittent hypoxia will cause somatic mutations. All of these things cause somatic mutations. And the somatic mutations are thought to be causing the dysregulated cell growth. But there are some cancers that growing dysregulated that have no mutations. They're not found. The work of Greenman and Michael Stratton showed that there are some breast cancer cells, breast cancers that have no detectable mutations, whereas the same strategy for detecting mutations are seen in another breast cancer, thousands of mutations. So clearly the technology to see the mutations is good. Some cancers simply have no mutations. And then we see all these driver mutations, which are supposed to lead to dysregulated cell growth. We see these driver mutations now in normal tissue of people. Young people like you guys, if we took a chunk of your tissue, whether it's from your skin or your esophagus or your liver or kidney, and we do a genomic screen, we'd say, wow, look at all the driver mutations in your, but you're perfectly healthy without cancer. So how can you call the driver mutation was named that because it was supposed to drive dysregulated growth. But now we have driver mutations in healthy cells that have driver mutations. How do you explain that? And then, of course, the most devastating information against the somatic mutation theory is the nuclear mitochondria transfer experiments. You put all that together with all these others, and it, as I said the other day, you have to be a hopeless ideologue to think that cancer is a genetic disease. Anybody with a rational mind that can sit and analyze data would say this is absolutely cannot be a genetic disease. So that means that the therapies that you're using based on the somatic mutation theory to treat patients will never be optimal if the theory is incorrect. That does not mean some people can't respond and be managed using poisonous radiation, poisonous chemicals and radiation and immunotherapies. There are people who survive, but the majority, you're not going to move the needle in any significant way using therapies based on an incorrect theory.